Hello friends, today we will be discussing poliomyelitis or polio, a highly infectious viral disease caused by the poliovirus. It primarily affects children under 5 years of age, although it can occur in unvaccinated individuals of any age. Polio is an important disease from both clinical and public health perspectives because it can lead to irreversible paralysis and, in severe cases, death due to respiratory failure. The virus is mainly transmitted through the fecal-oral route, especially in areas with poor sanitation. Although most infections are asymptomatic, a small proportion progress to involve the nervous system where the virus damages motor neurons, resulting in acute flaccid paralysis. Thanks to global initiatives led by organizations like World Health Organization, polio has been nearly eradicated worldwide. However, continued vigilance and immunization are essential to prevent its re-emergence. In this session, we will cover the etiology, pathogenesis, clinical features, diagnosis, management, and prevention of polio. So let's start with its distribution. Polio was a global problem in pre-vaccination era. After the introduction of effective immunization program and improvement of sanitation, more than 125 countries have eradicated the disease. Means the disease is not there in these countries. In September 1994, the Western Hemisphere was certified as a region free from poliomyelitis. On 27th March 2014, India is also certified as polio-free country. Presently, two countries, Pakistan, Afghanistan, were identified as endemic for polio. So, there are only two countries which are endemic for polio, and that is Pakistan and Afghanistan. In India, it is declared as polio-free country on 24 2014. The agent factors are agent which cause polio is poliovirus, which is an RNA virus of picornavirus group of enterovirus family. It has three serotypes 1, 2, and 3, out of which 80 to 90% outbreak of paralytic polio are due to type 1. Type 3 causes paralysis less frequently and type 2 rarely. So, the infectious one or the main outbreak is caused by type 1 virus only, and type 3 virus cause less paralysis and type 2 rarely cause any paralysis. So there are three serotypes in poliovirus. The second one is the reservoir. Human active clinical cases and carriers. Reservoirs are the places where this virus lodges and are potent to cause any infection. So the reservoir is human active clinical cases and the carriers, which itself is a human. So human only is the reservoir of this virus. Third is infective material. Infective material is feces and oropharyngeal secretion of human. So it is transmitted through fecal-oral route. As I said earlier, that the feces and the oropharyngeal secretion is there to cause this infection. The period of communicability is 1 week before and 3 weeks after the onset of disease. So 1 week before the disease or 3 weeks after the disease. So the communicability is the person is able to communicate this disease even before the infection itself, even before a week of infection itself, and after the infection, 3 weeks after the infection. So the agent factors are agent, reservoir, infective material, and the period of communicability. Then the host factors. In preschool children, it is more common. So age is categorized as the preschoolers are more prone to cause this disease. In gender, male are more commonly found older than female. So the ratio is 3:1. So males are more prone to cause this disease. Immunity. Maternal antibodies protect the child during the first 6 months of infancy as they feed their children during that period. And after that, immunity is often developed following the subclinical infection and after vaccination. So the first 6 months of a child is protected by maternal antibodies which are given by the mother feed or the mother milk. And after that, if there is any subclinical infection, the person is immune, or after immunization, it gets immunity. Then one environmental factors are in India, majority of the cases occur during rainy season. Overcrowding, poor sanitation, and contamination of food and water are the main favorable factors for the transmission of the virus. So, the unhygienic conditions mainly are the main cause of this virus spreading. The risk factors, provocative factors are there are certain factors which provocate the latent infection of poliovirus, resulting in the onset of the disease and paralysis. They are painful intramuscular injections, fatigue, trauma, exercise, surgical procedures in the head and neck regions, especially during the epidemic of poliomyelitis. So, see, these factors are those factors which directly may not cause the infection but are responsible for having that infection. So if there is any epidemic or the nearby, if there is any nearby person which are in carrier stage or case of polio, so if a person having injections or trauma or not taking proper rest or are more prone to get this disease as compared to the healthier ones. So the risk factors are these. Then the mode of transmission in the acute stage of illness, the disease is transmitted droplet and fecal-oral transmission. After the acute stage, it is transmitted by fecal-oral transmission only. So the main cause of transmission is fecal-oral only. Pathology and pathogenesis, the virus multiplies in tonsillopharyngeal tissue and intestinal wall. Then virus passes to the respective regional lymph nodes, that is cervical and mesenteric, where it multiplies and then enters the circulation and leading to viremia. Then virus damages the nervous system due to its selectivity, especially anterior horn cells of the spinal cord. So the first virus enters from the mouth through tonsillopharyngeal tissue and then get to the intestinal wall. Then while passing from these stages, it gets its space from the regional from this digestive tract to the regional lymph nodes, namely mesenteric and cervical lymph nodes, where it gets multiplied and enters the circulation and cause the viremia. After entering the circulation, it damages the nervous system due to its selectivity, due to its the favorable position, as this virus is there to affect the nervous system. So it selectively go to the anterior horn cells of the spinal cord from where it causes disease. So the selectivity of this virus is the nervous system. So from the digestive tract, it transmitted to the circulatory system. Then afterwards, it lodges into the nervous system. The clinical features are the different outcomes of the infection are as follows. 94% infections are subclinical. They are all asymptomatic or inapparent cases. They are diagnosed by rising antibody titer or virus isolation. So if we check such patient, the virus is there in their system, in their circulatory system or in their blood cells, but it may not have the symptoms. These are called inapparent cases. In 4% infection, there is minor or abortive illness which is mild, self-limiting and non-specific febrile illness. Disease does not progress, diagnosis is made as a in 4% cases, there are minor illness which are mild and self-limiting. In 1% infection, there is development of aseptic meningitis but no paralysis. It is called non-paralytic poliomyelitis. The patient will have all features of meningitis like neck rigidity, etc., followed by recovery. It gets recovered easily because it's not up to the spinal cord. It is limited itself to the meninges only. So it infects the meninges and cause aseptic meningitis, but no paralysis. And it is called as non-paralytic poliomyelitis. In 1% of infection, the condition progresses to major illness, where the virus invades the central nervous system, especially spinal cord, resulting in varied type of paralysis, that is paralytic poliomyelitis. So in 1% cases, the major illness cause and which invade and this virus invades into central nervous system, where the varied type of paralysis, that is paralytic poliomyelitis, can cause. Clinically, paralytic poliomyelitis is characterized by sudden onset of fever and associated symptoms such as headache, vomiting, malaise, and anorexia. Next day, fever is associated with several muscular pain in the limbs, followed by asymmetrical lower motor neuron type of flaccid paralysis. So, first day, the sudden onset of fever is seen, then headache, vomiting, malaise, and anorexia is felt. Then, next day, the person found itself severe muscular pain in their limbs and asymmetrical lower motor neuron type of flaccid paralysis. In mild cases, few muscles are paralyzed, and in severe cases, the entire limb is get paralyzed. Paralysis continues until the temperature returns to normal. So, if the temperature rises, the paralysis continues, and if it's normal, then it continues. There is no sensory loss. Residual paralysis is seen at the end of the movement. Tripod sign may be present. Tripod sign means the child finds difficulty in sitting and sits by supporting hand at the back and partially flexing the hips and knees. So the child is not able to sit properly. This is the tripod sign, which is a significant feature in polio. Cranial nerve involvement is seen in the bulbar and bulbospinal form of paralytic polio. The cranial nerves get involved in the bulbar or bulbospinal form of paralytic polio. There might be facial asymmetry as well, difficulty in swallowing, weakness, or loss of voice seen. Respiratory insufficiency can cause death. As we know that if there is not respiration properly occur, then the person may get die. Diagnosis of paralytic polio is also made by isolation of wild poliovirus from the stool. Diagnosis also can occur by the isolation of the poliovirus from the stool also. A rising title of complement fixing antibodies is confirmatory, which is confirmatory in nature. Then, from the treatment point of view, there is no specific treatment for polio. Good nursing care and physiotherapy is important in these cases. It helps the weakened muscles to regain strength. It helps the weakened muscles to regain strength, as you know that the muscles get weaker. The child may have to put on metal calipers for the rest of their life later on. So, as there is no treatment, prevention is important in this disease. So, for prevention, immunization must be done. It is essential to immunize all infants by 6 months of age, as after that it is not protected by mother's milk. Then, two types of vaccines are available in worldwide: Salk and Sabin. Inactivated Salk polio vaccine is known as Salk, and oral polio vaccine is known as Sabin. Salk contains all three types of inactivated viruses. Primary dose consists of 4 inoculations. The first three doses are given at 6, 10, and 14 weeks, and fourth dose 6 to 12 months after the third dose. Additional doses are given at the time of school entry and then every 5 years till the age of 15 years. Whereas Sabin contains all three types of live attenuated virus. So it is to be noted that in Sabin or the polio vaccine, the live attenuated viruses are there, whereas in Salk vaccine, inactivated viruses are there. And oral dose consists of 4 inoculations given at 0, 6, 10, and 14 weeks of age. One booster dose is given at 16 to 24 months of age. Salk vaccine given subcutaneously or IM. There is 7 is 2 drops oral. Salk induces circulating antibody but no local immunity, so it prevents only paralysis but does not prevent infection by wild poliovirus. It is not useful in controlling the epidemic. Whereas the oral vaccine is both humoral and intestinal, it prevents not only paralysis but also intestinal infection, so it can be effectively used in controlling epidemic as there is no carrier stage after taking oral vaccine as it controls the intestinal infection also. Then the administration of the Salk vaccine is costly, whereas Sebenix easy and economic. Immunity is shorter, that is 5 years for IPV, whereas immunity is lifelong in oral. Stringent conditions are not required to maintain cold chain for IPV. Stringent conditions are required to maintain the cold chain as here it is live attenuated virus, so we have to make it clear that the virus may live and can be safely used in immunocompromised persons. IPV1 is easily used in immunocompromised person, whereas the oral dose can't be used in the immunocompromised person as we introduce the live attenuated virus to the patient's body. Then, under the international health regulation, polio is subject to international surveillance. The WHO should be notified as soon as possible of the occurrence of polio, paralytic polio, and to supplement reports on such outbreak with additional epidemiological information such as type of virus and the number of cases and death reported. An epidemic is defined now as two or more local cases caused by the same virus type in any 4 week period. So, for polio, there is an epidemic if two or more local cases caused by the same virus type in any 4 week period. Then there are many pulse polio immunization programs running in our country, and the mopping up activities are also there. Hope you understand the subject effectively. For more details, please DM me or contact me. Bye. Thank you.